burning, discharge, odor down there, and you're not sure, is it a UTI or a vaginal infection? Is it a yeast infection, bacterial vaginosis? How do you know the difference? Let me clear this up for you right now. Treating the wrong thing can actually make things a lot worse. So it's very important that you know the difference between a urinary tract infection, a yeast infection, and bacterial vaginosis. And that's exactly what we're going to be discussing in today's video. Hi everyone, I'm Dr. Nabila, Noor, your gynecologist and a pelvic reconstructive surgeon, and welcome back to the channel. If you're new to the channel and like what you see, don't forget to hit the subscribe button and do share this episode with a friend. All the things that we're going to be discussing today are such high-yield information that every woman of all ages needs to know. So let's get started. So let me tell you a story about what happened last week. So in 1 week, I saw 3 patients all complaining of the same thing. They're feeling burning and discomfort and pain down there. But here's the kicker. One had a urinary tract infection, one of them had a yeast infection, and the last patient had bacterial vaginosis. Same complaint, yet 3 completely different diagnoses. So let me break it down for you. How can you tell the difference? Let's start with urinary tract infections, or commonly known as UTI. Now, when you have a true UTI, think bladder symptoms. Number 1, burning and discomfort during urination. It feels like fire down there as you're trying to empty your bladder. Number 2, urinary urgency. So this is that sensation that when you have to go to the bathroom, you cannot hold it, because if you cannot make it to the bathroom right that second, you're going to have an accident. Number 3, urinary frequency. You're going to the bathroom every half an hour or every few hours. Normal voiding is about 7 times or so, unless you're drinking a lot of fluid. But a lot of women with an infection will complain that they're having to run to the bathroom every half an hour or every hour. That's a red flag. Number 4, feeling pressure down there. This discomfort, this heaviness, all the time feeling like something is just off down there is also another red flag. And finally, number 5, cloudy urine, or in some cases, bloody urine. So there you go. So those are your 5 clear signs for UTI. So key thing to remember, most women with a UTI will not have any kind of vaginal discharge or vaginal odor. If you're having a lot of burning and discomfort down there, but you don't really have vaginal infections or discharge, most likely you have a UTI. Now let's talk about a yeast infection. With yeast infection, think vaginal discharge. Thick cottage cheese-like discharge. Some women will also complain of having redness and irritation in the vaginal area, burning and discomfort, maybe pain with intimacy. It's burning, but not necessarily with urination. It feels like it's burning all the time. So here's something to be mindful of. You can have yeast infection, meaning thick cottage-like discharge, but not necessarily have a smell, but not necessarily have an odor or a fishy smell, which is often a characteristic of BV, or bacterial vaginosis, which is what we're going to be discussing next. So when is it BV or bacterial vaginosis? Think thin discharge, watery, almost like grayish discharge. But here's the big difference. Your discharge has an odor, almost like a fishy smell. You could have some mild irritation, you could have some redness, but it's really the thin discharge with that fishy smell that is very characteristic of BV. So how do we as physicians know the difference? Of course, we're going to start with a physical exam. We're actually going to do a pelvic exam to look for these discharges. We will collect a urine sample as well as a vaginal swab so we can test it. A true infection or a UTI should show bacteria growing in your urine. Similarly, if you do have a yeast infection, we should see yeast growing in that culture, in that vaginal culture. And similarly, when we're testing you for BV, there are certain species of organisms that we look for that tells us that yes, the patient does have true BV. So very often I hear from my patients, why can't I just go to the pharmacy, get an over-the-counter gel for a yeast infection and just treat myself? Because here's the thing, you could be treating the wrong thing. It could feel like a UTI, but you may actually have a bacterial vaginosis. So making sure that somebody, a physician or a provider, actually does an exam and actually does test your urine, does a vaginal swab is so critically important, especially if your symptoms are not improving in more than 48 hours. And oftentimes, treating yourself with the wrong treatment can affect your vaginal microbiome, can actually cause yeast infections, as well as lead to antibiotic resistance, none of which is a good thing for you in the long run. So when should you see a specialist? Truthfully, if you have access, I would just go see a doctor at the first sign of symptoms so that they can do a testing and get you the right treatment. If you don't have access to a physician immediately, if your symptoms are getting worse and not improving within 48 hours, that's a sign that you need to see a physician. Also, if you're somebody who's pregnant, who's getting recurrent urinary tract infections, who's getting recurrent vaginal infection, as well as you're developing fever or back pain that's just not getting better. These are signs that, maybe other organs are getting infected, you're getting septic. You shouldn't take these symptoms lightly, and definitely don't wait, but get the help that you need. So there you have it. Hope you now feel comfortable knowing what's the difference between a UTI, a yeast infection, and bacterial vaginosis. If you liked what you saw, don't forget to hit the subscribe button. And again, do share it with other women in your life, no matter what their age. Because believe me, women of all ages get these infections, whether it's women in their 20s or women in their 80s and 90s. Also, don't forget to subscribe to my newsletter so that way you can have most up-to-date evidence-based information about your pelvic health right in your inbox. I'll be back again in a few days with another exciting and educational video about your pelvic health. So till then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye!